Hello, I'm Louise. I'm one of the nurses at Vision Scotland. I may be looking after you today. I hope you're comfortable and I would like to invite you to sit back and watch this short video. It's going to explain all your post-operative instructions. Please don't worry about remembering it all though. We will go through any questions you may have before you leave, and we'll also give you full written instructions to take home today. This video is also available to watch on our website, so if you need a refresher, you can watch it again later when you're hopefully feeling a bit more relaxed. Soon, a member of our team will come and take you through to our theatre. They'll make sure you're comfortable and explain any instructions you may need for the duration of your procedure. They'll make sure you understand what is going to happen during this time. Once your surgery is finished, you will be taken to our discharge lounge. We'll get you a drink and a bite to eat, and we'll make sure that you're feeling well and that you're fit and ready to head home. You'll have a clear plastic shield over your eye, and this must stay in place until tomorrow morning. You can choose to wear it in bed for the next few nights if you're worried that you might rub your eye by mistake whilst you're asleep. When you get home, please rest up for the rest of today. You might have some discomfort, so we would recommend taking some regular pain relief. This should make any discomfort manageable. You can take any over-the-counter medication like paracetamol or ibuprofen, whatever you would normally take for a headache or similar. It is completely normal for your eye to be red, watery, gritty and a bit blurry. You may also experience some double vision. Please don't worry, this will all settle down over the coming days. Some people may experience the grittiness a bit longer. However, for the vast majority of patients, this will settle over time. You can now watch television, read, use a computer or a tablet. When you get up tomorrow morning, please wash your hands thoroughly before you touch your eye. Gently run a cotton wool ball dipped in some cooled boiled water across your closed eyelid, from the inner corner to the outer corner, like this. Remember, only use each cotton ball once. You are now ready to start with your eye drops. You should have 2 bottles of these. The first one is called chloramphenicol and it is an antibiotic. It needs to be kept in the fridge. Pop 1 drop of this into the operated eye and wait for a couple of minutes before putting a drop from the other bottle in. These antibiotics are to be used 4 times a day for 1 week. You will get a chart where you can keep track of this with your paperwork. The second bottle of eye drops are called Pred 40. These are a steroid drop. You do not have to keep these in the fridge, and you will use these drops 4 times a day for 4 weeks. Again, there is a chart where you can keep track of this. It's extremely important that you use these drops as prescribed, so if you run out, please let us know and we can get more posted out to you, or you can collect them from the hospital. You may have been given some tablets to take as well. Take them as instructed by your nurse. Don't worry if you don't have any though, as not everyone needs them. You can now resume most of your daily activities. Please wait 24 hours after your procedure before you shower, bathe or wash your hair, and be careful don't get any shampoo, water or soap into your operated eye. Also, please don't use any eye makeup for at least 1 week after surgery. You must avoid strenuous activities for 4 weeks after surgery. This ensures that the pressure within your eye doesn't rise and it allows the eye time to settle down and heal. Strenuous activities include heavy lifting, gardening, sports, swimming, and heavy housework. Please avoid rubbing your eye for 4 weeks. If the world is seeming very bright to you, just pop on some sunglasses whilst you adjust to your new vision. You might also find that using a pair of ready readers is helpful during the time between your surgery and seeing your own optician in 4 to 6 weeks' time. At this point, they will measure you up for any new glasses you might need. It is normal to see your own optician for your planned follow-up appointment. However, should you also wish to see a member of our team, at Vision Scotland for a post-operative check, please contact us and we will be more than happy to arrange that for you. And this is included in your package price. Bear in mind, you must be able to read a number plate clearly from a generous 25 paces before you can legally drive again. You may fly after surgery, but it is important to only go somewhere with high quality eye care. Our recommendation would therefore be to wait a month before going abroad. As I explained earlier, it is completely normal for your eye to feel gritty, for the vision to be a bit blurry or even slightly doubled initially. Your eye may also look red and may be watery. These symptoms are completely normal and are of absolutely no concern. However, there are some things that we would want you to tell us about as soon as possible. Pain or headache around the operated eye, if this pain is not eased by taking regular pain relief. Nausea and vomiting. If your vision is getting progressively blurrier rather than improving. If you experience visual disturbances, flashing lights, showers of floaters, or if you appear to have a curtain or a blind pulled over a portion of your vision. If you lose your vision. You should also let us know if you start to have any thick green or yellow discharge coming from the operated eye. We will provide you with an emergency number to call should you experience any of these symptoms. We will go through any questions you may have before you leave today. However, should you have any further questions after today, they are likely to be answered in the literature that we've given you, but if there's anything you are still unsure of, please don't hesitate to get back in touch with us and we will do our very best to answer these questions for you. Now, try to relax, enjoy the peace and quiet of our Zen room. You're in very good hands with the Vision Scotland team.